Welcome to AOSIS Insights, where we unlock knowledge to the world. Today, I'm pleased to interview Dr. John Mangundu from the Durban University of Technology in South Africa, who is the author of the open access book titled Information Technology Governance Practices and Inhibitors in South African Private and Public Healthcare. We'll be discussing this book's contribution to the specific scientific discourse. Dr. Mangundu, it's a pleasure to have you with us today.
Thank you. It's great to be with you today.
Can you tell our viewers a bit about yourself and your involvement in this field of study?
Thank you very much. So I started this study in 2014 when I realized that there were a lot of problems, especially in the public healthcare, with regards to the provision of healthcare and the use of information technologies to leverage and improve service delivery in this sector. So the minister reported at one point that information systems in the public healthcare were not aligned to their objectives, and it wasn't helping them to meet the needs and the demands of provision of healthcare systems in South Africa. Among other issues that could have been problematic, I felt IT governance could be one of them. Then I started on this journey. So after that, as a lecturer at the Durban University of Technology, I undertook a professional course on IT governance through ISACA. From there, I learned a lot. Then I felt, let me apply my knowledge that I got from that course to undertake a study through the University of KwaZulu-Natal at a PhD level. It was for a degree purpose. So I went around, targeted one government healthcare, then in the private sector, one biggest private healthcare provider in South Africa roped into the study and said I was welcome there and they would participate in the study. Thank you very much.
Thank you for that introduction. Now, let's talk about this book's contribution to the field. How does it contribute to IT governance in healthcare systems, and what impact do you hope it will have?
Thank you very much for that question. Yes, I believe the book will contribute a lot. It's a multidisciplinary. It touches on healthcare and it touches on information technology. And the bridge that exists is around IT governance in that sector. I believe that the book contributes to theory, it contributes to practice, it informs policy, because we have seen that our information systems, especially in the public healthcare and in some instances in the private healthcare, they are disparate systems which does not communicate to each other. So we end up having problems. For example, the use of drug abuse, where people go to different hospitals collecting, for example, those antiretroviral drugs, which are used to make a certain drug called Nyaope. It's well known in South Africa as Nyaope. So because these systems don't talk to each other, these people, they go around collecting and they can't be identified to say you have collected from this hospital, so you can't collect from another hospital. So they end up collecting those drugs and convert them into harmful drugs. So IT governance now, it comes in as about how decisions are made around these information systems. So if these information systems are made from a communal point of view, then we can have information systems that talk to each other, that serves the same agenda, rather than having this separate, isolated system which can't communicate to each other. It makes provision of healthcare services very difficult, misaligned. There's no value in those information systems. It becomes a cost to the government and even to the private sector in that regard. So yes, I'm happy that the book contributes to theory, practice, and informs policy. Thank you very much.
So for the viewers who are keen on exploring this book, we invite you to visit our website at books.aosis.co.za. You will be able to access and download the open access PDF, whether it's already published or once it becomes available. To publish a book with the AOSIS Scholarly Books, download the electronic book proposal form from our website, register your profile on our website, and submit your proposal for consideration. It has been a pleasure having you with us today, Dr. Mangundu. Thank you for taking the time to speak with us.
Thank you very much.